This is terrain heading to Dandu area, which lies on the western side of Mandera County. It is generally safer than other parts of the county, since it is miles away from the frontiers of Somalia. But it has not been a smooth sailing accessing medical care for the residents here, and this has been due to lack of machines and equipment needed. But that narrative is changing thanks to county government partnership with Philips and the UNFPA.
Hii imebadilisha service kwa sababu tunaweza kuwa tukikosa height tunaangalia mwaka, na ilikuwa shida kupima wale wanaingia, lakini kwa saizi wengi ndio tumepata tukiwapima wanaingia.
This new community life center is equipped with modern medical machines and equipment aimed at improving basic primary health care in the community. It also involves training and capacity building of health workers in operation of the machines powered by clean and safe energy.
This is our second CLC that we do in Kenya. So the first one was in Kiambu, which is more of an urban setting. And we all know Mandera County is one of the most remote locations. So to us it's great to be part of this partnership, and it's also great to see that we can also realize in such a remote location.
Other than children, expectant mothers have had a bigger burden of accessing the right and timely medical care, making childbirth almost a death sentence.
At the inception of county government, that we've inherited a county that has registered the worst maternal mortality rate in the world, which is 3,795 deaths per 100,000 births, was a nightmare to even internalize for us.
Fatuma Abdullahi is here for the first ever antenatal visit in her 8th pregnancy. She's physically disabled and grounded. She depends on her husband and all the children for movement since she lacks a wheelchair. Out of the 7 children she has delivered, 2 died a few days after birth, and she recently suffered a miscarriage. Fatuma is among hundreds of pregnant women in the area who throng the health facility to have a glimpse of what their unborn children look like and even hear their heartbeat through the ultrasound scanning. A blissful experience for many mothers worldwide.
She said she's very happy and she's ready to tell other people that
the scanning machine can detect birth complications early enough for correction. This is a plus according to health officials in the county, and will go a long way in reducing deaths of mothers that is higher than in any war-torn country in the world.
We can be able to diagnose any abnormalities, especially during the antenatal visits. And you know, if you diagnose abnormalities during pregnancy, you can be able to refer that mother so that she can be able to access services that will help her. Ultrasound is an expensive test. Now they are getting free of charge in Dandu. So they used to travel all the way from here to Mandera to access ultrasound, which is about 350 kilometers, or to Moyale in Eastern Province, which is about 200 kilometers.
Poor maternal health care provision in Mandera County has been of serious concern, especially in remote areas like Dandu. Since the inception of devolution, the county has been able to have about 13 ambulances to assist in taking patients to hospital and increased skilled healthcare providers from 152 to 853. This includes community health volunteers. The county has 20 maternity centers to date to assist women during delivery.
we diagnose something like multiple pregnancies. We diagnose obstructed labor. We diagnose breech, especially breech in primary.
This new primary care and community hub is part of partnership aimed at improving access to quality primary health care and to decrease maternal and infant mortality rates, especially in remote areas like Dandu. Most of the complications have been attributed to cultural practices like FGM, early marriages, and lack of adequate facilities and equipment. As Mandera County continues to blanch and peel off some of the healthcare challenges it faces, Dandu residents, especially mothers during deliveries who are at a higher risk of losing their lives, hope that this is going to help them reduce the maternal mortality that has placed Mandera County as among the highest in the world. Eunice Omollo, NTV from Mandera.